right, good morning, everybody. So, as mentioned, my name's Joe Brothman. I get the pleasure of speaking to you today on behalf of UCI Health. I'm going to talk to you a little bit about our new campus that we're building in Irvine, California. And I'm not leading the team, I'm a member of the team. There's a huge group of people that are overseeing the design, the construction, and then the operations of this project. And just really lucky to be here with all of you at this beautiful new campus here, or resort here in Park City that I actually used to live in, and really appreciate your time taking it to listen to me today. So I'm going to first start out by telling you a little bit about the University of California UC Health, which is the health division of the University of California, and our role in California, and then I'll get into UCI Health, and then our new campus project, and then get into a little bit about what we've learned about electrification with new major campuses and some of the lessons that we've learned. And if you have any questions after that, I'm happy to take them. But the UC's mission in California is really trifold. So there's three fundamental missions with the UC. It's teaching, research, and public service. So the UC educates students of all levels, from undergraduates to advanced graduate students. Our graduate education involves developing and testing new hypotheses and interpretations, and we create an educational workforce that enhances California's economic competitiveness. In research, we conduct research across hundreds of disciplines at our campuses, national institutes, laboratories, medical centers, and research facilities. Our research generates numerous benefits for California, including economic growth, technological innovation, job creation, healthcare advancement, and improves the quality of life for everybody. And it's played a vital role in developing industries like the internet, semiconductors, software, and biotechnology throughout the world. And public service. The University of California's deep public service traditions date back to its origins as a land-grant institution in the 1860s. We were an agricultural extension that serves Californians in every county, and we actively engage in public school partnerships throughout the state to develop institutes, strengthen teacher collaborations and expertise to improve student welfare statewide. So a little bit about UC Health. There are 6 academic health centers. It's comprised of 20 health professional schools, a global health institute, and a system-wide service that improves the health of the university's students and their employees. Then the UC hospitals are ranked among the best in California and in the nation, and its long-established health professional schools are nationally ranked in their respective areas. So this map, you can see all the different schools: UC Davis, UCSF Health, UCLA Health, UC Riverside is starting out their health schools, UC San Diego, and then where I'm from, UCI Health. So a little bit about UCI and why we're really trying to pioneer some of the things that we're working on and some of our history. Molino and Rowland were researchers from UCI in the 1960s, and they were instrumental in discovering CFCs, which were contributing factors to the ozone hole back, well, forever. They were awarded the Nobel Prize in 1995 for their work. Ralph Cisneros was our chancellor, our 4th chancellor for UCI, and he was in the 1960s and 70s one of the champions letting the world know about the impending climate crisis, one of the first atmospheric researchers to really bring this up to the world. So UCI has been passionate about minimizing impacts to the climate. It's really deeply rooted in our DNA. A little bit about UCI Health. We are the health enterprise for the academic side of UCI. We have over 10,000 coworkers. I think a little more than 12,000, 12,300. A little over 1,300 licensed beds, 6 medical centers. This is the 6th one we're building right now. Over 40 locations throughout Orange County, a little over $4 billion worth of revenue. We're the only academic level 1 trauma center in the county. A little over 1.4 million outpatient visits, 41,000 surgeries, a very busy place. We recently acquired 4 additional hospitals about a year ago throughout the county, and we're working to incorporate that into our health network. So lots of stuff going on in addition to building this $1.5 billion new campus that we're working on in Irvine. So getting into that a little bit with our campus overview, if you're not familiar with where Orange County is on the map, here we are. If you're familiar with Disneyland, we are the closest hospital to Disneyland. So if you could see where up top a little bit, you could see in the top left corner, that's our legacy campus, UCI Health. We're 14 miles. The new campus I'm talking about is 14 miles south from our legacy campus on the UC Irvine main academic campus. So this new site was built with the June 30th, 2019 sustainability policy that was published by the UC system, which mandates that no new buildings, if at all possible, will be built with fossil fuel combustion for heating or for space heating or water heating. That does not include steam generation, but we put in a self-prescribed goal, a stretch goal, that we also would not, for this project, have humidifiers or steam generation using natural gas. So our DPP requirements, no fossil fuel generation for heating or hot water or steam. So again, this project sits just north of the UCI main campus. This was the original render for the site. So there is a hospital, an ambulatory surgery center, an outpatient medical office building, 2 large parking centers, and a central utility plant. And then in between the campus and our new campus, there's a marsh, which is protected wetlands, which we also had to respect. So in addition to those prescriptive DPP requirements, we wanted the facility to have an all-electric central utility plant, reduce light pollution for the local community, incorporating LED and light controls, reduce water consumption, and incorporate heat recovery chillers, as well as be at least LEED Gold, but we achieve LEED Platinum now that we're finishing construction. So getting a little bit into the campus, an overview of the project. We have 3 major buildings again. The Center for Advanced Care is the outpatient medical center, the inpatient hospital, which is our acute medical center, and a medical office building. They all were under construction. 2 of them are now fully constructed. The Center for Advanced Care has been seeing patients since late 2023. Our ambulatory surgery center, our child comprehensive cancer center, was opened up late 2024. And our inpatient hospital is slated to open by the end of the year. Licensing is December 10th. Construction is still underway, but we are wildly underway getting this finished up. It's pretty crazy. If you've been through finishing up a construction project like this, you know the final few months are like crazy. So that's right where we're at. And we have a big timer that says how many days, hours, and minutes until we see our first patient. We turned the power onto this site a little before the Center for Advanced Care went up with our central utility plant. So our central utility plant's been up for a little over 2 years, which is really exciting, which again has no natural gas to it. And I'll get into a little bit about the building. So this is the Joe C. Wen Family Center for Advanced Care. This is a medical office building, again, all natural, no natural gas powering any of these sites. This site houses multiple specialty clinics as well as an entire 2nd floor dedicated to the Children's Hospital of Orange County, which is a partnership with UCI Health. The building is a little over 168,000 gross square feet, 120 exam rooms, 18 minor procedure rooms. Again, 100% electric, but we do have diesel backup generators to provide backup power for the entire site. There we go. Here's a stacking diagram located with co-adjacent to a parking garage. So you can see here we have an autism center as well as about 17 other clinics that are all adjacent to one another. The next building, which just opened late last year, is the Chow Family Comprehensive Cancer Center and Ambulatory Surgery Center. My favorite building because it's so beautiful. It's a cancer center with 36 exam rooms, and each cancer center has 3 pods inside of it. We have a breast cancer center with 8 exam rooms. There's 10 outpatient surgery centers, or surgery rooms with 3 procedure rooms as well. We have 34 post-anesthesia care, prep, and recovery rooms, 2 linear accelerators, an MRI, and a LINAC, 34 infusion bays on 1 floor. We have a research and cell therapy lab as well as a full conference center on our 1st floor. And then a stacking diagram of this. You could see, and I'll have a full stacking diagram that you could see where our surgery center is. We have a surgery mega floor that's going to connect this building with our hospital. So both the outpatient surgery center and our inpatient surgery floor are connected, so we can get some real synergies with having those 2 sites connected. And this also has a parking structure attached to it. And here's our inpatient hospital, which is still under construction, again slated for final completion, or substantial completion September, and licensing in December. We are 144 beds, so fairly small, especially for that price. We have all beds are standardized to ICU capable. So even though all the rooms, we have multiple suites and departments, all can be swapped up to ICU capable. We designed this during COVID when I'm sure a lot of you were converting your rooms to ICU rooms. So all of our rooms are private and can be dual occupancy or 3 occupancy, and all can be brought up to ICU capable. The emergency department has 20 treatment rooms and 5 rapid assessment spaces. It is not a trauma center, though there might be plans later on in its life to become one. There's 16 acute observation beds, 12 interventional inpatient surgery spaces, and 34 post-anesthesia care, prep, and recovery beds. So all in all, we'll have 25 surgery bays in this hospital. And here's this large stacking diagram. So you can see that ground level there. It's one connected floor. These are both the surgery, the Chow Comprehensive Surgery Center, as well as our hospital. That ground level is a shared floor that is basically a surgery mega floor. We're going to be able to share a lot of our soiled parts department, equipment storage, post-anesthesia care, all of that with both outpatient and inpatient surgery, and hopefully get some real efficiency gains with that shared floor there. It's just really challenging right now because we have a construction wall that's bifurcating the whole thing. So I'm really looking forward to having this construction completed. So getting into a little bit about the electrification of the site, I'm probably not saying that right, excuse me. Central utility plants are, as you know, critical infrastructure for sites like hospital campuses. They offer significant benefits, including reduced greenhouse gases and improved energy efficiency, except they also present challenges such as the need for electrical capacity, especially when everything is coming from the grid. It also provides increase for potential disruption due to, again, everything coming from the grid. Some of the costs and benefits of the project that we really accounted for were taking an assessment beforehand and engaging with our stakeholders to let them know that some of these risks that we're looking at and making sure that we had buy-in from all of our stakeholders to minimize that disruption. So we reviewed the Central Utility Plant and electrification, the project and the highlights with our caregivers, and let some of the lessons that we learned as project managers and engage with them through the planning process before the beginning of the project. This included an assessment of the electrical capacity and impact on the existing systems, and let them know that, you know, we're circumventing some of those risks through having redundancies and overbuilding for the operation, but there was still going to be a huge impact, potential impact on their operation, but we're going to be trying to monitor these systems as much as possible. So some of those systems, a lot of times people wonder, like when you're building an electric site, what does that mean? So first off, the challenge, healthcare is one of the most energy intensive industries in the world. Inpatient healthcare specifically makes up less than 3% of total building square footage, but it takes up 10% of America's electricity through mostly HVAC, but also kitchen, steam, lighting, all those things. It's because we are such an energy intensive industry. Uh, Typically, half of the electricity that a inpatient hospital takes is through fossil fuels. Natural gas power is typically how that's achieved through steam, heating hot water, pre and reheat cycles. And then that's because we're constantly running. We're 24/7 operations, which are intensive operations. Typically, we have old and outdated machines and infrastructure, especially our MEP. As many people know, we're not always upgrading those things. They're not as sexy as MRI machines, which also take tons of electricity. So those are all contributing factors as to why uh, these hospitals are such energy hogs. So with this project, we had some estimates and goals for the energy use intensity of the buildings. The average you could see here, and then our goal for these projects are what we tried to do a third of what the average hospital inpatient space, and then for our outpatient space, same thing here. So for a traditional steam distributed system for a campus like this, you can see you have a central utility plant where you produce that heating hot water or steam, and then you pipe it through a distributed steam system. It might go to your central boil or your central sterile processor, your operating room, anywhere, your kitchen that you might be using that steam. This is what you probably find in any campus or medical center that's using a centralized distributed steam system. Here's how we're building this with heat recovery chillers, air source heat pumps, and electric resistive heat through modular and point of use steamers. Uh, Basically, putting every point that is using steam, we're putting those electric steamers at the ORs, at the soiled part department, at the kitchen. We have a full electric kitchen. Uh, Everything is either point of use, modular, or trying to electrify in our central utility plant, our heating and preheat water distribution system. We have the largest array of air source heat pumps this side of the Mississippi. And it's really an exciting project, but it does come without some challenges. The last talk we were talking about um, challenges with finding people. So we've been sending a lot of my team to training to learn how to use these systems. We've had 2 years of bringing people in from the manufacturer to train our staff on how to maintain the systems, because there's one thing about handoff and then there's another thing about maintaining it. So definitely resonated with me when they were bringing that up. And then just, I think I touched on it, construction timeline. We're wrapping up the hospital, and this project will soon be finished. So 2/3 of it is pretty much done. We're wrapping up the hospital construction right now. We'll be finished before the end of the year, and would love to see you come and tour our site here in Irvine. I think this is the last site. I would just have a couple cool pictures with construction. That's when they put the final beam on the hospital. They put their little plant on the beam there. And this is them putting the emergency department sign on the new hospital as well. I think I'm right at time. Yeah. So thank you all so much for letting me tell you about my project.